When it comes to trauma or accidents to the mouth, it's best to start off in two different categories anyway. You've got your child. So say if your child has an accident and it hits their front teeth and it happens to be their baby teeth, the most important thing is to not panic. Just wait and see what happens. If they're actually in pain and discomfort, then you can often, consult your dentist or your medical practitioner, but just use some anti-inflammatories and try and let it heal up. If the tooth is completely removed, or what's called avulsed out of the mouth, so it comes out, and it is a baby tooth, just leave it out. Don't panic, don't do anything about it. It is a baby tooth. There is an adult tooth that will come through. But as soon as you can, then try and consult with a medical practitioner, or better still, a dental practitioner. Then when it comes to adults though, it's a different story altogether. So I really can only sort of talk about major trauma when it comes to adults, because if there's minor trauma, like you've cracked a tooth, hit a tooth, it's been knocked during something, yes, it'll be a bit sensitive, yes, it'll be a bit sore. The use of anti-inflammatories and the use of painkillers is important in that regards, but unfortunately it's a wait and see game, and then contact your dentist as soon as possible. If there is a major trauma where the tooth once again has been pushed back in, out, completely out, things like that, it's very important to try and consult with your medical practitioner, or more importantly a dental practitioner, within the first few hours, as they can try and reposition the tooth. They may be able to put it back in. The very important thing with a tooth that has come out is that you do not wash the tooth with water. You try and put it back into your mouth, you leave it in your own saliva. And if it has only been moved or shoved around a little bit, then try and find some sort of retentive device that may be able to hold the tooth in place while you find the dentist. One of the most common injuries is the sports injury, so a sports mouth guard is the best in trying to put the mouth guard into place. It will also somewhat reposition the tooth into the position it was, because it is made for your mouth, so therefore it is moulded to where the teeth used to be anyway. The important message with major trauma in adults is you really need to try and contact a medical practitioner or a dental practitioner as soon as possible. Sometimes your local hospital is your best port of call.